Welcome to Experience Army Medicine Interviews. Our mission is to interview local medical professionals within the Army so they can detail their impact in medicine today. Today's interview is with Lieutenant Colonel Brian Yoon. He hails from Evans Army Community Hospital, Fort Carson, Colorado.
Brian Yoon, and I'm a 61 Juliet, general surgeon. I did attend the United States Military Academy as an undergrad student, and naturally during my time there as a cadet, looked into opportunities for attending medical school on the HPSB scholarship. Was given the opportunity to apply to civilian medical programs after my time at West Point, and found myself attending an osteopathic medical school in New York City, specifically Harlem. And so had a great opportunity to interview there and do my medical school training there on essentially the Army's dime. They supported me financially through that time there, and they also helped provide a stipend to make ends meet while I was living there as a starving medical student, and it all worked out for the best. Specifically, during my time as a cadet, I was trying to figure out, do I want to be a pilot or do I want to go in the medical field? Those were my two big pathway points. And ultimately decided to go into the medical career because I wanted to really use my skill sets to take care of them, improve their overall state of health. The idea of being a pilot was exciting for the adventure factor, and being able to fly aircraft sounded neat, but I think ultimately for me and my skill set, as well as my interest in biology and the life sciences, the medical career pathway made the most sense. I had a really unique experience being able to attend medical school in Harlem for a couple of years to do all of my lectures series in a classroom setting. And then beyond that, essentially performed most of my clinical rotations in hospitals in New Jersey on the other side of the Hudson River. And again, all of that was fully supported by the HPSB scholarship. I was able to interact with patients that were essentially, out of New Jersey, Queens, a little bit in Long Island as well. So it just gave me a really good breadth of experience to try and see what fit best for my future specialty. So coming right out of medical school, I was given the opportunity to do my surgery residency within the military. There were some other opportunities for medical students to apply to civilian residency programs as well. As the Army identified an ever-growing need for general surgeons, they opened up the doors and expanded those opportunities. The mentorship has been fantastic. I get to interact with senior surgeons that are still active duty as well as civilian. Some surgeons have retired from their time in the military, but have decided to stay on within the military system to continue delivering their surgical care to patients that are in need. I've had the opportunity, especially here, to interact with, again, a breadth of different surgeons from different backgrounds. We call them the gray-haired surgeons for their wisdom, and that's been a fantastic opportunity for me to grow as a younger surgeon. Some of the best opportunities have really come from just my time in the operating room here, being able to perform robotic-assisted surgeries. We're at the tip of the spear with the technology that's available on the market right now, and being able to provide the best far-forward surgical care to our patients here has been a really neat experience with the advanced technologies. We can do more and more minimally invasive surgery with smaller scars, smaller incisions on the belly, even in the chest, because of our advanced technologies. So for me, that's been a source of passion and pride for me because we have the capability here, we're using it to deliver the best care for our patients. Thankfully, we have ample opportunities for CME these days, thanks to the advent of online training and online conferences, access to on-demand videos. We can get a lot of our advanced education through some of the apps on our phone. There are lots of forums where we can find a lot of in-depth collaboration with other surgeons, other colleagues as well, outside of the military sector, where we can glean and gain some wisdom and mentorship as well. And then for specific conferences that are planned out in advance, we can definitely attend those conferences with the full support and funding from the Army as well. I think for anyone considering any kind of medical career within the military, the best advice I can give is be resilient. Find that grit within you, because there will be plenty of stressors and challenges along the way that are unpredictable and sometimes unprecedented. And so the key thing is to stay positive as best as possible, find your community within the military. My favorite part about being in the Army are honestly the people. The people that I work with, my colleagues are fantastic, and so it's always good to have someone to lean on for some of that wisdom and guidance as you kind of go through your struggles. There will be plenty of struggles within the military with deployment and training activities, online training, things like that. But having your core group of people to rely on can help really build that resiliency and make you more stronger at the end of the day.
Thank you for listening in on our Experience Army Medicine interviews. We hope that these interviews help encourage your own path into a healthcare career. If you enjoyed the interview, please don't forget to like, follow, and share our content as we continue to dive deeper into Army medicine. Be all you can be Army medicine.